I think that ElixirMD is doing something very different that nobody else has ever addressed. So the product is trying to enhance the post-operative recovery phase of the patient by decreasing bruising, swelling, decreasing the downtime, decreasing scarring. The industry standard for downtime is this. We want to make that recovery easier and smaller so that you can get back to doing things sooner, quicker, with less problems. ElixirMD has 3 primary protocol treatment points. The first treatment point is to reduce bacterial load on the skin and prep the tissues for upcoming surgery. Treatment protocol 2 is post-operative. This is addressed in order to help the tissues heal, minimize bruising and swelling, and make that recovery process quicker. Treatment protocol number 3 is the final treatment protocol after surgery, which is kind of the persistent tissue reaction healing as well as maintaining tissue integrity long term. So you're selectively using different wavelengths of light in order to choose what those cells are doing at different points in the healing phase. And ElixirMD is using that principle to use different wavelengths of light to affect the cells to affect healing. I think the number one thing that I bring to the game is skepticism with a scientific background. You have to prove it to me, okay? And this is with anything. I had a patient, and this was one of the first patients I treated with Elixir, okay? And she was a revision facelift patient. This lady is on camera every day, and first question, how soon can I get back to work? I did the whole Elixir protocol on her, did a revision deep plane facelift. She was able to wear makeup and go in front of a camera 4 days post-op. In my own hands, that was impossible before ElixirMD. I mean, I'm good, but I'm not 4-day good, okay? I mean, it's just impossible. I know the amount of work that was required on her. I know what I did. And in the best of circumstances, there is no freaking way I could have gotten her with makeup in front of a camera in 4 days. So that was the first time where I was like, this works. I had a revision, 3rd time revision rhinoplasty, okay? And this lady had no bruising 2 days post-op. Those results, like, that it happens with such degree of repeatability that it is not a random event. You cannot say it's a random event if it happens 10 times in a row, 15 times in a row, 20 times in a row, and I've never seen these types of results before. Whether it is a patient who's able to go back to work 4 days after surgery, whether it is no visible incision lines on an Asian patient who has the highest predisposition to scarring, and at 2 weeks post-op, you can't see the incision lines. These are patients who have had surgery, had the exact same surgery, had surgery by a good surgeon, and are telling you head to head, it's better. The quicker you can get to the point where the patient is happy, satisfied, they are liking the result, they're happy with themselves, everybody's happier. The rate at which that happens is much better in my practice, faster in my practice with ElixirMD than without it.